Hi guys, welcome to Joen Academy. Today we're diving deep into the fascinating world of the shoulder, specifically focusing on a group of muscles called the rotator cuff. You see this? This is a model of the human shoulder. It's a complex structure of bones, muscles, and tendons. Now, the rotator cuff isn't just one muscle, it's a group of 4 muscles that work together to keep your shoulder strong, stable, and mobile. Think of them as the unsung heroes of your shoulder, allowing you to lift, throw, and reach with power and precision. These muscles are super important in our everyday lives. They help us do everything from brushing our hair to playing sports. Imagine trying to lift a heavy bag of groceries without your rotator cuff. It would be nearly impossible. First up, we have the supraspinatus. This mighty muscle sits on top of your shoulder blade, originating above a bony ridge called the spine of the scapula. It then travels beneath the acromion, which is part of your shoulder blade that forms a protective arch over your shoulder joint. The supraspinatus then inserts onto the top part of your upper arm bone, known as the humerus. What does the supraspinatus actually do? Well, its main job is to lift your arm out to the side, a movement called abduction. The supraspinatus is like the engine that initiates this movement, giving you the power to lift your arm away from your body. This muscle is supplied by the suprascapular nerve. This nerve sends signals from your brain to the supraspinatus, telling it when and how to contract. Next, we have the infraspinatus and teres minor. These 2 muscles work together as a tag team, both assisting in the external rotation of your arm. The infraspinatus originates from a large area below the spine of the scapula called the infraspinous fossa, while the teres minor sits just below it, originating from the lateral border of the scapula. Both muscles then cross the back of your shoulder joint to insert onto the back of your humerus. Imagine turning a doorknob or using a screwdriver. Those movements require external rotation, and that's where the infraspinatus and teres minor come in. The infraspinatus is supplied by the suprascapular nerve, just like the supraspinatus. The teres minor, however, is supplied by the axillary nerve. These nerves ensure that both muscles receive the right signals from your brain to coordinate their actions. Last but not least, we have the subscapularis. This muscle is located on the front of your shoulder blade, originating from a large, triangular-shaped area called the subscapular fossa. It then crosses the front of your shoulder joint to insert onto the front of your humerus. The subscapularis is the only rotator cuff muscle that sits on the front of the shoulder blade. Its primary role is to internally rotate your arm. Remember the external rotation we discussed with the infraspinatus and teres minor? Well, the subscapularis does the opposite, helping you turn your arm inwards. It's like turning a doorknob the other way or using a key to unlock a door. This muscle is supplied by the subscapular nerve. The subscapular nerve ensures that this important muscle receives the necessary signals to function correctly, contributing to the overall stability and mobility of your shoulder.